This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
It's a good day to be healthy, but then again, that's every day, right?
That's right, John.
Good morning and welcome to another edition of Health Watch every Sunday right here on Talk Radio 1210 WPHT, 8 till 9. That's where we are and that's where you are, and we're happy to be here with a lot of information to help you improve your overall quality of life. That's what we do here on the show with Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number. If you have a question or you have a medical challenge and you want to run it by Dr. Molly, well, then you call up 855-839-1210. Happy to be here for another edition of Health Watch. And as always, Dr. Molly, we start with, what do you do anyway, Dr. Molly?
Well, yeah, I know. That's true, John. And you know what? First of all, I want to say, John, I wish the audience could see you, because it is light years from when we had a little problem.
Yes,
and I want to say how good you look.
Yeah.
And it's because you've really been following a lot of what we've been trying to tell you, both the medical providers and the rest of us, because, you know, that was a scary thing.
Yes, it was.
And I will tell you, I'm thrilled because your overall quality of life certainly has improved.
Well, I think it's a testament to you and your staff that I recovered so quickly.
Well,
because we saw in this debate the other night that
sure.
a person who had it worse than me,
no question,
still hasn't really recovered. So it's
takes
really
time, John.
He definitely didn't go to you. So
well, listen. I'm not going to take the credit for this, because the good Lord upstairs is the ultimate physician, and we all know that. But I will tell you also, you changed your lifestyle. And,
yes.
You know, and what happens to all of us, this is just a word of caution before we go into the overview. What happens to all of us is we get complacent.
Yes.
Because we're feeling pretty good.
Yes.
People who come to our facility start to feel pretty darn good. So then all of a sudden, you know, maybe we're having a little more steak dinners. Maybe we're having, instead of the one martini, we're having two. Yeah, same old. And we're all about quality of life. So I understand that. But again, sometimes we've got to go back to just good old-fashioned taking care of ourselves in an appropriate manner, and that's where we come in.
Okay, and hey, I'm living proof.
And God bless. But the overview is very simple. We are a primary care facility, and that's where all of the healthcare providers work out of my facility. And so we're able to do anything any primary care practice would do for you. You need medication, get it. You need comprehensive radiology, we send you out for it. You need some specialized testing, we can do it. We actually have the draw site right on site. So all of those things can be done. But what's really the difference is the philosophical difference, in that we want to use the least amount of pharmaceutical to correct your challenge without putting a patient at risk, without causing there to be a problem from the underlying condition that drove them in to see us. And really do this with natural substances, the kind of things you might get at the health food store, and utilizing hydration as the vehicle to deliver those. Pretty simple.
The $64,000 question, always given to you. Does it work?
Yeah, yes, I would say. And the answer is yes. It works certainly in terms of our objective to improve our quality of life, maintain a patient's homeostasis or balance, and actually help them have a good quality of life and go about their daily duties and actually enjoy some life. That's the point.
Do you have data that can show
Sure.
where it comes into play?
Sure. I can show people lipids that have been reduced by use of a subclinical dose maybe of the statins and our protocols. And I've had people whose lipids have improved by getting off the statins, which actually is good because of the side effect and the newer drugs that are injectable. I also have data to show people with things like echocardiograms, should we need it, so you can see an improvement in their cardiac function. But I think the most important way I can show this is come on in and talk to people in my chair.
Yeah, that's it.
Because they will tell you, it's like talking about neuropathy, which is the painful condition lots of diabetics get.
Yes,
right?
yes,
Right, in
yes.
their extremities. Well, I can show this past week, I have a patient who came to us who had a wound on her feet that has subsequently cleared up. It looks great. And she had her yearly or semi-yearly visit with her vascular guy, and he said, I don't know what you're doing, but I don't need to see you anymore. And she said, what? And she knew, because she knew that not only did the wound clear up, she was having less leg pain, those kinds of things. And she actually gave me the report. I have her report. I didacted out her name, obviously. But I have a report to show people that there are ways this hydration therapy, delivering natural amino acids, as well as some man-made ones, we can improve your circulation.
Now, you don't get them off the medication that they're on.
Not usually. We try to cut it down.
That's cutting it down.
We have gotten people off their meds. Sure. I mean, that's a medical decision that the docs will make, and they will help somebody. Just had that this past week. Actually, we switched up someone's we switched up someone's hypertension meds because they were taking the wrong category for them. After going through a series of our treatments, we saw that we were able to lower the blood pressure. But that's only one area. I mean, let's talk about one of the things like autoimmune. How about improving people through their cancer treatments? We absolutely can.
That I know you have, because there's many
They'll tell
cancer
you.
patients who have really been helped by your protocols. But talk about what you can expect. The initial consultation, you get that.
Right.
And then let's say you sign up.
Sure.
What do you expect at that point?
Well, here's the thing. I will sit down, put together a protocol for the patient. It may take some time, meaning we will actually get them started. I will put together a particular protocol for each individual patient, because I want to use certain nutraceuticals for certain things, and also cross-reference these nutraceuticals to their condition so that we can improve their quality of life. That takes a little time. So I would say most people start to feel improvement somewhere around 5 to 6 weeks, assuming they come in once or twice. It is
pretty quick.
Improvement.
Yeah.
I'm not saying fully, but certainly somewhere around 15 weeks, we have seen people, they just take off.
What's your favorite as far as what you use? Vitamin C or?
Well, vitamin C, as you know, is your favorite.
That's-
So yeah,
that's mine.
That's right. But I can't say that I have a favorite. My favorite thing is looking at the patient's condition and saying, okay, how can we help this patient really enjoy their quality of life, whatever that is? For example, for some people, it's running around with their grandkids. You know about that,
Yes, right.
Okay, so that's one thing. But for others, it may be playing tennis. So that's a little more, in depth. I want to look at amino acids. So there's no such thing as a favorite. My favorite thing is to help a patient achieve their goals.
And you can expect 5, 6 treatments, 10
You're gonna
treatments,
start,
20 treatments.
Right.
What?
Well, it
what is
depends on the condition and how badly you come in. I mean, obviously, if you come in with a condition that you've had for the last 3 years, and now you're finally coming around to say, oh, well, I want to walk a marathon. I want to walk the marathon, not run it. Okay. Yeah. Well, that's going to take a little time.
Yeah. Okay. We are coming up on our first break of the morning. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio, 855-839-1210. And as you know, we always tell you, call early so we don't shut you out of not being able to get in. Call early, and we'll be happy to take your question. Dr. Molly will talk to you about whatever your condition happens to be. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly and I will return after these words. Hi, it's John DeMasi, host of Health Watch, heard every Sunday morning 8 till 9 and again from 4 till 5 here on Talk Radio 1210. Is chronic pain or fatigue making it difficult for you, or maybe someone you know, to enjoy simple pleasures like walking your dog or spending time with the grandkids? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates offer medical hydration therapy. Their autoimmune therapy program has helped hundreds of patients to feel better and do more.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Visit innovativemedicalassociates.com to learn more about their autoimmune therapy program. Join me and Dr. Molly Sundays, Health Watch, 8 till 9 and again 4 till 5 here on Talk Radio 1210. As you know, operators are standing by right now at Innovative Medical Associates, and they're there to talk to you. If you want to make an appointment with Dr. Molly, sit down and go over your situation and your issues, whatever they happen to be. That's really how you take advantage of the free consultation. 856-489-0505. 856-489-0505 is the number. And again, operators are standing by right now, and they will be there. You can call now. You can call after 9 o'clock. They'll be there all day. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And again, the number here in the studio, 855-839-1210, if you want to talk to Dr. Molly right now. I guess we should call this the disease of the week.
Yes, the condition of the week.
The condition of the week.
Yeah.
And it's not Haley's Comet.
No, that's right.
So
it's Haley.
Haley. What is this?
Okay. Haley, I mean, in its purest sense, is a genetic dysregulation of a particular gene that causes the symptoms and signs of Haley, which actually are painful, blistering skin rash that really happens in the folds of the skin. So like in the armpits, the groin, neck, under the breast, between the buttocks, those types of things. Now, if it's truly Haley's, right? In other words, Haley's can't just be you go in, doc looks at you, especially your family doc, looks at you and says, oh, yeah, that's Haley's, right? No, because it can mimic severe cases of psoriasis, some other autoimmune disorders, that kind of thing. So I had a patient who came in to me, and she really says she has Haley's, but I can't get from her, did she have a biopsy to show that it's Haley's? But okay, I'm going to work on her in the next few weeks because I asked for the medical records. But I'm taking her at her word. She knows what she has, and it really looked terrible, John. It's a terrible rash, and it's everywhere for her in all the places that I spoke about earlier. But what's interesting is, can we help improve her quality of life? The answer is yes. And how do we do that? Well, we can try by reducing the burden of chronic inflammation, which may help take care of some of the symptoms. Would I do that with what? I would do that with vitamin C, maybe with certain collagen peptides, these kinds of things. Now, this case gave me time to pause because it's not something you usually see. And I can tell you, in all 26 years, I don't think I ever had a case of true Haley.
I never heard of this.
I know. That's how obscure it actually
really
is listed in the rare disease column in terms of the NIH. But anyway, so of course I immediately go out and start doing the research. Well, I find that there's one obscure article about Haley and vitamin D3. Okay. Now, they were using an oral supplement of vitamin D3 for 3 months, but at a very interesting level, a little bit higher than what people usually their physicians tell them. So I started thinking about this, and of course I have vitamin C that I have compounded for us from my compounding pharmacist, also in a very interesting compound because I use an oil for it that is high in antioxidants. So it's one of the things I'm going to be using for this patient. But frankly, this is going to be what I consider more research from the holistic point of view or the biochemistry point of view, more likely in terms of hydration, utilizing something for Haley's. But I think the most important thing that I imparted to this particular patient is, listen, you know there's no cure. If you have Haley's, there's no cure. Right?
Okay.
What can we do? We can improve your symptomatology. We may be able to hold down reoccurrences of the rash, also by using tinctures that I love to use, both from Italy, Germany, and a subclinical dose of a particular pharmaceutical that's used completely off-label. So it's going to be a very interesting case. I think we can hopefully see improvement, but do you think she's going to be a 5 treatment person? No way.
I would say 15 minimum.
At minimum.
Yeah.
And why? Because I need to get some of these anti-inflammatories in. I have to work with, fooling around with these, see which ones work, and move forward with it. But it's very interesting, and I'm thinking also about consulting with my consulting derm on this case. But anyway, she's in my chair. I'm going to keep everybody posted, and let's see.
This is really a very, very rare case.
Exactly.
How did you discover this?
Well, I have to go by what the patient tells me. She believes that it's Haley. Now, the physicians looked at this. We've seen her, and they're like, well, I think it could be psoriasis. I think. Well, it could be anything, but we'll know when we get. We've requested the medical records, and if there is a skin biopsy in there, and it purely shows that it's Haley's, we're gonna move ahead, and I'm gonna move ahead anyway. Look, one thing we do at you ask what separates us from we believe our patients. We believe our patients.
This is another thing that separates you.
Yeah, exactly. I want to believe our patients, and what we're going to do is work like heck to improve her quality of life. That isn't just to reduce the flare-ups, but to give her some incentive to continue to enjoy some life, because it's a mess.
I would think, and you're the expert here, but I would think with a condition that there's no cure for, maybe she's got to be a lifer. Maybe not every week, but every other week or something like that.
Listen, you have to reduce the burden of chronic inflammation no matter what you have. That is true for everything. And in this case, I think it's even more. And so, again, we have to look at this, though, in the context that this is a genetic disorder. And what we can improve is we can't cure it. And don't worry, traditional medicine can't cure it either. But can we help improve her quality of life? I check the box that says yes.
Okay, 855-839-1210 is our number here in the studio. And again, if you have a question or a medical challenge or whatever it happens to be, 855-839-1210 is the number. And Dr. Molly would love to hear from you. 855-839-1210. Just want to touch on your cancer support protocol.
Sure.
And we mentioned it briefly earlier, but what exactly does it do, and how can it help?
Well, here's the
patients?
thing. This is interesting because it goes back even to the case we just talked about. We have to reduce the burden of chronic inflammation, because what happens here? We're talking about inflammation. I hate like heck for us to continue to talk about inflammation, but it can be the devil. It's good and it's bad, okay? Two sides of the same coin. So we must reduce the burden of chronic inflammation. But in addition, with the cancer support treatment, we have to address miscommunication within the immune system. In other words, why does someone have a situation where a tumor grows? Right?
Yeah.
We need to look at that. So we do. And, cancer has many strategies, and everybody knows that we are looking at new immunotherapies that allegedly are helping and curing, and God bless them. God bless the oncologists. I have a consulting oncologist myself, but one of the things we know is as he likes to put it, cancer is a beast. You want to get to it. You want to help people return to a quality of life, even when they're going through the cancer treatment, because nothing is worse than being depressed over your condition and staying in inertia.
Do you have, I know you have a lot of cancer patients who suffer, and then finally they discover you and they come in, and it does ease the burden somewhat of the cancer. Of course it does. I'm not saying, but we're not curing cancer. But what we are doing is improving their quality of life, whether they choose to go the conventional route, whether they choose to go all natural, whatever we want to. Again, I want to support the patient where they are. So I believe the patient. And that's what our whole system is about. Our whole clinic revolves around personalized patient care, truly personalized patient care. So we get to understand what the patient's goals are. Nothing excited me more this week. I had 2 cancer patients. One is my wonderful sister Fran, who came to me, and she had a clean bill of health with her PET scan. But her new surgeon, unfortunately the surgeon I referred her to moved to Texas. Oh. So the new surgeon is absolutely gung-ho on doing an additional surgery as a preventative or prophylactic measure. Well, Sister Fran came in, and she's very well read, and as I like to tell her, she has the big physician right on her shoulder. That's right.
And she said, I've been thinking about this, Dr. Molly, and I find that you've improved all of my quality of life. I said, well, sister, he's improved your quality of life. She goes, yes, but I'm feeling better. I'm doing everything. I've cleaned up my diet. And I told the surgeon, I really don't want to do this based on my age and how I'm doing right now. And she was intelligent enough to look up the PET scan and said, why isn't this thing metabolically active if it's something to worry about? So I said, sister, she goes, well, I learned that from you and Doc. I said, I know. It wasn't metabolically active. So what did we act as? The surgeon called me. I told the surgeon, listen, I promise you we will work very closely with you, but if the patient doesn't want the surgery, what can I do? She said, you're right. Just send her back to me every 6 months so that I can maintain a relationship, but I'm really happy she's with you. I said,
there's a clear-cut example of how you patients really learn from you, and the care that you give them is really second to none, and that's really a testament to you. We try. And I can testify to that too. Well, so we are coming up on it's the halfway point of the show. Wow. Time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number in the studio, 855-839-1210. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll both return after these words. And we are back here on Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505. I'll say that slower, 856-489-0505. That's the number, and you can call them and make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and like I've always said, that's really where you find out what you need to know about whether you want to move forward or not with Dr. Molly. 856-489-0505, and the website innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And again, our show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. If you want to talk to Dr. Molly right now, 855-839-1210 is the number, 855-839-1210. Dr. Molly, you have some really intelligent, we were talking during the break, you have some really intelligent, well-educated patients.
I sure do.
Who really think outside the box And we're going to talk about your pharmacist patient.
He's coming in this week, and he's a longtime listener of us. And he actually emailed me asking about certain peptides. I find that very interesting because more and more work is being done. Peptides are small chain molecules that really have a lot to do with many of our systems. So we tend to lump peptides in a kind of thing where people who were bodybuilders, this kind of thing, talk about them all the time. You go on the web, you see a million peptides for what? For muscle mass, this kind of thing. But actually, peptides are involved with many other things, including, believe it or not, weight loss today. They're also used in digestion, and they're used in various other systems. So they help with communication in the body. One of the things I found interesting is he had specific peptides in mind. And we are finding that more and more holistic-minded physicians like my guys and people like myself, scientists, are looking at these and seeing how they can improve patient outcomes, improving patient quality of life. Okay, can make you stronger, have less brain fog, etc. So, but we have to be aware that, really it's quote unquote trials. There are always trials. They haven't been approved. Lots of things can be used by physicians off label, but they really haven't been approved by the FDA. The reason why I mentioned this patient is it goes to show you that people in the business understand the use of certain things, and they're not worried whether they have FDA approval or not. They know that they're out there, and if used properly and compounded properly, there's a place for them in a medical facility.
Can you explain what a peptide is?
It's small chain molecules, proteins. So we usually look at long chains, which are the amino acids, but the peptides are smaller molecule chains. So they're shorter, and there's many of them, and they're in many systems. I suspect the most well-known one right now is the peptide diets. There's a million of them that sprung up. A million of them, truly. And the thing about them is how they're using the particular peptide to actually cause the body to, it causes the stomach to empty the contents a little slower. So as a result, you have a full feeling when you're eating, so you cut down on your food. I have a patient right now who lost 75 pounds. Now, it is approved. This particular peptide, by the way, that particular peptide is approved by FDA because they made a drug out of it. All right?
Okay.
So what I'm saying is these kinds of things are out there. People should seek them out and do the research and know that my physicians' patients know all about it. And I have several doctor patients, including my associate medical director. And I have nurses and pharmacists and people in the business. So they're out there, John.
What is this pharmacist, or what is his condition, and why did he choose peptides?
Well, he doesn't have a condition, right? He has what he thinks is a tear or something now. So it's really orthopedic in nature. But this is one of many. But I said peptides are used in medicine and in medical research for many things, John, including some autoimmune diseases, which I want to get into as soon as we can.
Okay, well, let's get into it.
Okay. So, I am really, because I've been bombarded with this past 2 weeks, and I'm seeing more and more autoimmune diseases. And part of the problem is they aren't straightforward, okay? You can't just make a diagnosis lots of times on an autoimmune disease and say, oh, it's lupus, oh, it's MS, oh, it's Parkinson's. No, because there's a lot of overlapping symptomatology, right? So it can be very difficult. And many times people come to me and they have a level of frustration because they know they have the brain fog, they know they have the fatigue, they know they have rashes, but they don't know what it is. What I try to do is say, okay, yes, we've done all the testing, Dr. Molly, and they'll bring me a ton of testing, like the ANA, testing that you would normally do for autoimmune disease, and yet they're all negative. Doesn't mean they don't have a subset of autoimmune disease. In other words, they may have symptoms of several autoimmune diseases. But what does it always go back to, John? My favorite thing.
inflammation.
Right. And it takes time. And the approach that I have to use is, okay, how do I reduce the burden of chronic inflammation? Well, we know that anti-inflammatories will do this. Plant extract anti-inflammatories like curcumin will do this. Things like vitamin C will do this. We may have to look at hormonal levels. Maybe we have to think out of the box about the testing. One of the things that I like to do is we can use a autoimmune type panel and look for certain white blood cells and see if they're a little bit out of whack. I look for the viral, the antibodies. All of these things point me in the direction of how to work with patients who have chronic autoimmune disease.
It seems to me that it would be hard to diagnose this.
It's terrible.
Because you said you could test and it's
everything
negative,
could be negative.
And then you got it anyway.
Right.
So how do you do that?
So what you have to look at is various testing, and mostly you have to look at the quality of life that the patient, what drove the patient to come into us. I can tell you that in many times it's the fatigue, it's the joint pains, it's could be the rashes, it can be the brain fog. And I would say that there are some of the underlying kinds of conditions. Weakness, very interesting weakness for a lot of the neurodegenerative autoimmune. But in the end, they all have certain components. So the idea is you got to put the puzzle pieces together and say, okay, do they have viruses? Are they making antibodies to HSV? Are they making antibodies to CMV? Therefore, they've had the exposure. What about post-Lyme? Do you think that might be an autoimmune syndrome? It's a syndrome. It isn't fully, it's not a condition, but people have the syndromes of many of these conditions that can be helped with hydration.
And with that, we are coming up on our final break of the morning, which means that you still have time to jump in here and get a question in for Dr. Molly or a medical challenge that you have, you want to run by her. 855-839-1210 is the number, 855-839-1210. Dr. Molly will be happy to talk to you right here on Health Watch. And that's what it is, Health Watch. That's the program, 8 till 9 every Sunday, right here on Talk Radio 1210 WPHT. We have some final thoughts with Health Watch today with Dr. Molly and John DeMasi here after these words. We are back.
Hey, John does okay.
We are back here on Health Watch. Don't forget, if you want to talk to Dr. Molly during the week, you schedule the appointment, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Oh, and don't forget, if you missed any of today's show or you want to hear it again, we have our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. A few minutes left of the show. You still have time to call in at 855-839-1210. 855-839-1210 is our number here in the studio. And they caught us here. We were talking during the break. What are we going to talk about?
Okay, it's all right, John. Yeah. It's easy. What I want to talk about is I want to wrap up our approach to all inflammatory disorders, whether it's the cancer or a subset of autoimmune. So again, I'm going to look at reducing the burden of the chronic inflammation. So how is that done? Anti-inflammatories, going over the patient's diet too. So anti-inflammatories in terms of the hydration therapy, because I'm able to deliver a therapeutic level of certain anti-inflammatory IVs, including curcumin, including vitamin C, maybe some amino acids, anything that would help reduce the burden of chronic inflammation, okay? Because that's what starts our cascading. Then I want to reduce the burden of chronic micro-infections. And you're going to say to me, well, what the heck is that?
Yeah, well,
okay.
I was.
Well, yeah. It's bacterial infections, it's parasites, it's fungus. In other words, we have to use antimicrobials. And in that regard, we use things like lysine, melanorin, things that really are natural in nature that we can deliver through the hydration. And how does somebody have this? Well, we're exposed environmentally. We may have a post-Lyme condition, and we may have bad bacteria in our gut, which we know all the time. We would then go over probiotics for the patient and what they need. So that would be number 2 in this. The third thing is we want to restore the innate immune intelligence. By that I mean our body is programmed, our white cells are programmed to do their job and to defend our body against outside invaders, right? And not turn on ourselves. So we want to do this by utilizing natural products. And there are many, including extracts of mushroom. Very interesting.
Now, I wouldn't think that would be
no,
one
but
that
it
you'd
definitely
use.
helps with innate immune intelligence. And we've seen this, and there's lots of PubMed data to support the use of extract of mushrooms. Okay, beta-glucan being one of them. So that's something. And finally, I want to stimulate the white blood cell count, meaning the production of the white blood cells that do the job, that will be mobilized to go after the invaders. So if you have a bacterial infection, I'd expect to see some changes in your CBC. The other thing we need to do is we might want to look at your sleeping habits and utilize melatonin. And melatonin has a high antioxidant property as well. So we're able to deliver that IV, assuming you're not driving home, I want to say. Okay? But this is the approach, and it's a 4-pronged approach to autoimmune, to the cancer supportive programs, and many of the other things we do.
Okay, so you've explained how you treat these conditions.
Yes.
Let's say somebody went to their regular doctor and he prescribed or she prescribed pharmaceuticals.
Yes.
Would they be, or would they have a lot of side effects? Would they be harmful?
They could. No, well, I'm not going to say they're harmful. The idea is you want to use the least amount of side effects. So, for example, if you're having the joint pain, do you want to go right over to Humira? I don't think so. I think you'd probably want to try something in a more natural route that has an anti-inflammatory in nature. But, I have young people who immediately they had the GI problems, which is Crohn's, that kind of condition. Well, we like to use a subclinical dose of a traditional drug that wasn't put out for Crohn's disease at all. And as a result, we're looking at a difference between 100 milligrams. We might use 0.5 in that scenario. So you can see how the difference, no side effects. So we want to minimize the side effects of the traditional drugs. I'm not saying throw them out. Have I ever told anybody throw out their medication? I never will. But I can tell you there are ways to enhance your outcome and possibly reduce the particular pharmaceutical you're on and still get the job done.
So that's been your philosophy with just about everything.
26 years.
Yes. 26
years. But what has changed is the availability. Listen, I tell everybody, get on the Natural Alliance for the Alliance for Natural Health, because more and more of your rights are going to be stripped away. Go into the health food store, you'll see changes already. They want to eliminate a lot of the products. They want to make them pharmaceuticals and actually, or medical foods. And we can talk about that at another time. But I'm telling folks, they really need to look at what's out there and know we have a right to treat the way a patient wants.
Okay, real quick, we're coming close to the end of the show. What can a patient expect in the initial consultation? What can you tell them, or what would you tell them?
I need to know what's driving them to me. Why do they feel that this clinic might help them? What are their particular goals? Because my quality of life and your quality of life can be very different. And how we can help them. And I will sit there in the consultation, and I'm already thinking of the game plan for them.
And the initial consultation is about a half hour. And
yes, more or less.
The next time you make a half hour, it'll be the first time.
More or less. All right. That's the Italian way, more or less.
But explain. I mean, you really explain the clinic and what it is that you do.
Absolutely.
And really, they can talk to patients.
Sure.
And I know they can talk to me, and they can talk to.
They talk to a lot of people when they're there, and a lot of people want to share their story. And actually, that's quite healthy to share your story because, look, I can't take the minds of all the patients I have. I mean, it is what it is.
Yes. So the initial consultation is a half hour.
About a half an hour, and at that point, we can see if we can help you. And, John, I have had situations where I've told people, listen, you're not in great shape. This is what's going on for you. Let me help you the best way I can. But honestly, you need more traditional treatment.
Yes,
and I've done that.
Yeah, you've done that for me, and you've done that for lots of others. Right. Well, that is going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. And check out the web, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, you can hear our show again from 4 to 5 this afternoon on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Catherine, and Lana, and then there's fabulous Fran, delightful Dee, Joanne, and our medical assistant, caring Kathy. Thanks for listening. We will talk to you next Sunday, 8 till 9, Health Watch, right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.